Hello, everybody. It's lovely to see you all, and a really amazing venue, isn't it? It's just so nice to be here. My name is Rosie Green. I am a beauty journalist. I've been doing it for a very long time. I started at Elle in my early 20s, and then went on to be, I was beauty director there, and went on to be Red beauty director, and I'm now at You magazine, which is the Mail on Sundays Sunday supplement, doing their beauty. So a lifelong love of it. So I'm very excited to be in the presence of greatness. And so I'd like to introduce the panel. This is Dr. Alexis Granite. And I'm actually going to get her to tell you about herself.
Hi, I'm Dr. Alexis. I am a dermatologist, originally from the US. I did all my training there. And now I am based in central London at Sarah Chapman in medical and cosmetic dermatology.
That's a very modest introduction. She's amazing. And this is Sohère Roked, and she's going to tell you about herself, also a very amazing woman.
Hi everyone, I'm Dr. Sohère Roked. I'm a GP, but I specialise in hormones. So that's menopause, perimenopause, cycles, and I also come from the functional medicine elements. That's really looking for the root cause of what's going on with people.
And lastly, the lovely Clare Bourne at the end, who could tell you about herself.
Hi everybody, so I'm a pelvic health physiotherapist, which not most people have probably heard about, but a physio, as most of you probably know, but I've got a specialist interest in the pelvis and the pelvic floor. I treat women and men throughout their lives, from childhood all the way through to menopause. That's what I do in clinic and other bits and pieces on the side.
Brilliant. Three amazing women who I could ask questions of all day, but we haven't got all day, sadly. So what I'm going to do is start with Alexis, and we'll just do 10 minutes with each person, and just find out, really their thoughts on their special subject and any advancements they're excited about. So I will kick off with Alexis, who I have known for a long time, who's a brilliant dermatologist. I think, given the audience, a lot of us are very interested in the changes that happen to our skin in midlife. And so I just wondered if you might talk to us about, the people that come and see you and what they're most concerned with.
Yeah, so I think we all know, I think once you reach a certain age, that there's a lot going on in the skin and a lot of changes that are occurring. And when I think about it, I sort of look at it from the top down. So when you think about superficially in the skin, as we get older, pH is changing, the skin is drying a bit. You're going to start to see some of the effects of chronic sun exposure, so things like pigmentation and redness. When you think about the mid layer of the skin, so the dermis, that's where all your collagen and elastin and hyaluronic acid are. And sadly, as we get older, that layer will thin considerably and our collagen production will diminish. So actually around the first 5 years of menopause, you lose about 30% of your overall collagen. And then we continue to lose about 2% of your collagen from thereafter. So a lot going on in the top part of the skin, a lot going on in the middle, and then actually deeper within the skin, you will even start to see changes in what we call the deep fat pads. So you have this nice, juicy, sort of fatty layer that gives a lot of volume when you're young, and unfortunately, as we get older, that layer will thin. And we're even seeing bony changes too. So the bones themselves will start to thin out as we age. So all of that translates into a lot of what we see with the aging process. So we start to see fine lines and wrinkles, we see dryness, we see volume loss, a little bit of sagging. So there's a biologic basis really for all of the changes that we're seeing.
Well, that's, that's definitely what I'm seeing. I guess it would be nice to talk about some sort of major skincare wins, but in terms of lifestyle, what do you think is the big things we can do to sort of slow down that process, or just get the best skin we possibly can, keep it healthy and happy?
Yeah, so actually there's quite a lot you can do. So interestingly, it's thought that when we talk about aging, about 25% of aging is what we call intrinsic aging. So that's aging that's due to your genetics and unfortunately is a bit beyond our control. But that leaves 75% of aging the process, which is what we call extrinsic aging. And that is very much in our control. And that is all of those elements of our lifestyle. So things like, for example, sun exposure and UV exposure and pollution. So exposure to those kinds of elements actually causes what we call free radical damage in the skin, and that contributes to collagen breakdown, elastin breakdown. So obviously, controlling our exposure to things like UV and pollution will really help. smoking, smoking is bad for pretty much every every part of your health, skin and otherwise. So avoiding smoking is a big one. Stress plays a huge role, which we know in our overall health and certainly within the skin. So stress is a big promoter of a hormone called cortisol, which increases inflammation throughout the body, and that plays a huge role in skin aging. And then things like diet, exercise, sleep, all of those will contribute to the rhythm of our skin, of our body, and making sure that we're optimizing those can really help with the aging process. So really, a big part of how we age is controllable by lifestyle changes that we make.
And do you see that in the women that come to you? If there is somebody that sleeps well and eats well and doesn't smoke, is there a marked difference between the opposite?
Yes, I mean, absolutely. And I think another area where we see that quite a bit is a bit generational. So sadly, probably in our generation, we weren't as careful with things like UV. I don't want to speak for you, but myself, I certainly was not as careful with UV exposure as maybe we are now. We're seeing, so much more awareness of how important it is. So, patients of mine that are aging now, they grew up, let's say, 20, 30 years ago or more, and we're starting to see sort of the catch-up of the UV exposure that they had in those young years. So I think just building awareness of all of this now is going to put, people that are kind of going through that process now, it's going to put them in so much better place in 20, 30 years because they don't have that leftover damage from when they were young.
Okay, that's so interesting. And I know that you're very interested in skin and mood and how actually, we talked a bit about stress, but how actually, to make us sort of real positive about beauty and beauty rituals. And so do you think, what's your sort of take on, beauty products as mood boosting or beauty in itself as mood boosting rather than something that makes us feel worse about ourselves?
Yeah, absolutely. I think it's really important throughout the aging process to kind of take it maybe with a little bit of a grain of salt and approach it with a little bit of humor as well. Yes. Otherwise, it can send you maybe to a very dark place. But I think that we know from sort of in dermatology that mood is intimately linked with the skin. So I sort of see it as almost like a feedback cycle. So we know that patients who suffer with skin disorders, things like acne, psoriasis, eczema, are much more likely to have low mood, depression, anxiety. In fact, patients with psoriasis are up to twice as likely to suffer with depression as those that don't have psoriasis. So we know that I think really you can't underestimate the power of how we feel about our skin and how that can impact our mood. But equally so, I think there's sort of a reverse feedback where, how you feel about yourself also impacts the skin. So it all sort of ties in together. And so I sort of see the treatments that I do, tweakments, and, as things that can help to boost your mood, boost the way you feel, boost your confidence, but equally not something that you should feel obligated or like you have to do, because I think, to be honest, that just adds to stress.
Yes.
So I think it is about finding that balance, and I'm very much sort of an everything in moderation, whether it comes to, diet, lifestyle, exercise, and also to tweakments. So, I think that advice is maybe a little boring because it's been around for a long time, but I think it lingers because it is good advice.
Yeah, well, the best advice is, And how would you, we talked a lot about the changes in the collagen and the, the sagging and the pigmentation. I guess if we take the collagen, how would you boost collagen for somebody that's feeling that it's sort of fallen off a cliff, i.e. me?
Yeah, we have a lot of options. We can use a range of things. So you can do kind of very minimally invasive treatments all the way to sort of more invasive kind of injectables. So I would start with potentially someone who's younger and maybe just wants a little bit of a collagen boost. We could think about something like microneedling. So that's where we take very fine needles on the skin, and by inducing trauma to the skin in a very sort of measured way, we can induce the production of collagen and elastin. Somebody who's looking maybe for a bit more sort of a collagen boost, that could be something like skin boosters. So these are injectable treatments that incorporate things like hyaluronic acid or polynucleotides, and those are injected into the kind of mid portion of the skin, again, to kind of add hydration and stimulate collagen. And then you can go to sort of deeper treatments, things like RF microneedling. So I don't know if you've heard of Morpheus 8, but there's other options as well. And those kind of work on a deeper level to deliver energy energy into the skin, which again kind of induces a controlled injury, which allows that collagen to be rebuilt.
Well, that is incredibly fascinating. Thank you. Sign me up for all of those. Thank you, Alexis. I'm going to move on to Dr. Sohère here. You are an amazing GP and specialist in hormones. I think a lot of us don't really understand the role that hormones play in our sort of happiness and in our health. So I just wondered if you could give us the top line on that, really.
Sure. So in terms of hormones, we often think about, starting your period and ending your period in menopause. But actually, hormones are going to affect you all the way throughout your life. So I think it's really important to get in tune with your cycle if you're having one, because it's going to tell you, are there certain times when you're happier, you have more energy, you can do more in the gym? Are there points where you feel a bit sadder, you can't sleep as well, you can't handle stress, you can't focus, or you feel overwhelmed? So hormones do play a part basically in every single week of our lives. Now, we all know about the circadian rhythm, our sort of 24-hour cycle. We have more energy in the morning, less energy at night. But women having a cycle have an infradian rhythm. And that's our basically 4-weekly cycle where we might feel different every single week. And we're kind of not really taught to engage with that. Periods are something that happen. We just get on with it. We're women, just crack on. But actually, if we can get a bit more in tune with what's going on in our body at different times of the cycle, we can then harness that to do different things at different times of the month. So there are certain times when I do a bit more high intensity exercise, other times when I'm like, more walking and yoga at the moment. Same with the way I eat, same with even sometimes socializing, like, if I can bump that to a different week when my estrogen's a bit higher, then I'll try and do that. So I think it's just really great to become the expert on you. And rather than seeing our hormones as something that controls our life in a negative way, we see it as something we can harness, and it can be empowering then to take control of it.
I love that message. What issues do are most people coming to you in their 40s, or is that a sort of big tranche of your clients?
Well, things have really changed. So I've been prescribing hormones for over 10 years now. And at the beginning, it was pretty much just menopause, so people coming in their 50s or late 40s. Then it started going into the perimenopause because the NHS wasn't treating the perimenopause up until very recently. The advice used to be like, come back when your periods stop. And quite frankly, the bit before your periods stop is often the worst bit. So people used to come and see me for that. And people still do, because I have a way of tracking things and giving people advice on how to manage things. But now I actually see a lot of people in their 20s and 30s, because that information is out there that hormones are affecting us at all different stages of our life. So people are coming in a bit earlier to get in tune, know what's going on, and then hopefully that will cause an easier transition into all the different areas in our life.
Brilliant. And what sort of, with the midlife women, with the perimenopausal women, or menopause, what are they coming to you and saying? What's the sort of main issues and concerns they have?
Well, we always talk about hot flushes for menopause, and that is a major factor. But actually, that's not really the thing that brings people in through the door. It's quite often, I've lost my confidence. I don't feel competent in work situations. I'm snapping at my kids and my husband more than I should be. I can't sleep. That's a huge one. I know for me, if I'm not sleeping well, that massively affects everything. And just like, I'm not enjoying my life. A lot of people say to me, I've got no reason to feel sad or like unmotivated in my life, but I feel like I'm just going through the motions and I feel like it's not me. So they're normally the things that bring people in through the door rather than just hot flushes.
Yeah, it's interesting. You'd think it was the physical, but it's actually quite a lot of the menopause. And so what are the common mistakes that you see people making, apart from just thinking they can't do anything about it, which I imagine lots of people do?
So I think that if there's an issue, it's always good to seek help and go and see somebody. But I think the part that I think it's important to educate people on is that there's so much that we can do ourselves that can also make a difference. So not going, it's my fault if I'm having menopausal symptoms, not that at all, but seeing it as a shared thing, very much like it's partly a hormonal change, it's partly how I'm doing things in my lifestyle. So I think looking at things like nutrition, how you move your body, and certain supplements can be of benefit, and also just tracking what's going on with you. Become the expert on yourself. That's the biggest advice I can give you.
And do you think for most women out there, it's useful to see a specialist? Do you think the GP training has come up, or do you think it's still patchy in places?
I think GP training is a lot better. Just bearing in mind, I did my GP training about 12 years ago, and the advice then was very much like, if someone wants HRT, tell them they can't have it. If they still want it, tell them they're going to get breast cancer. And if they still want it, then give it to them. And I think we've come a very, very long way since then with the, all the advocates like Davina McCall and other doctors who are promoting menopause treatment. And I think that's absolutely fantastic. So I think seeing the GP these days can be a good port of call. However, what I would say is if you're not getting the results that you want, don't take it as, oh, well, HRT is not for me. I gave it a go and it didn't work. There are many different ways to do HRT. So seek out someone who you resonate with, who you think could help you.
That's amazing. Thank you. And just moving on to Clare at the end, who is a pelvic floor specialist. Could I ask you, I think people, the biggest thing is probably that people really struggle to talk about it, right? Do you still come across that?
Absolutely. And I think it's because our education, if we look back, if we're talking about even thinking about menopause, we were told nothing. Then if we talked about, no one's talking about pelvic floor really until, if you choose to have children, you might get a leaflet thrown in your direction at some point. But really, there's not this education that's there, unfortunately. I think the problem is as well as a lot of the symptoms that we have as a result of pelvic floor issues are still quite taboo or they're hard to talk about. There is not as much airtime. I mean, I'm seeing a huge shift. We had a documentary about pelvic organ prolapse that came out last week. Now, that is, in my opinion, quite revolutionary. That's not been talked about in the mainstream. Incontinence, more so, but there is still so much. And these are not easy things for us to talk about ourselves, let alone go to a doctor about. And then if that reception is not great, then we lose our confidence. So we've still got a long way to go, but it's exciting, I think, the time that we're in. But they're not easy topics.
And just for anybody, out there, your pelvic floor controls your urinary incontinence. Does it also control fecal? And what does it control?
Absolutely. So yes, our bladder control, really vital. So obviously being able to keep things in when we want to, but also the sensations that we get. So if you realise you're going more frequently or urgently, that can in some way, it's about, pelvic health is more than the pelvic floor muscles, but it can be related to your bladder muscle, which is a muscle as well, different to a bicep sort of muscle, but still a muscle. So yes, your bowel control, but our sexual function as well. And also the pelvic floor muscles are vital in kind of just our overall control of our core, spine, as well. And they actually help to pump. I was hearing a talk earlier about like lymph and stuff in the body, but our pelvic floor muscles are really vital for pumping blood and lymph around the area as well, which though we never think about and probably just take for granted, it's doing an important job. And I think that's a lot of the time is they're muscles that we don't necessarily have to think about until there's a problem. But I think a lot of the time, and we know this from research, that actually being proactive about things is really better than being reactive. Unfortunately, in this country, our healthcare system is based on being reactive rather than proactive. And I'm not being critical of that. There's reasons for that. But I think if we can all educate ourselves, even things like the skincare element, I feel like listening to you both, there's so many layers and how we can relate that to our whole body.
Yeah.
The more we educate and empower with that message about all areas of health, the better.
And what do you think, what are most women coming to see you about? They coming post-childbirth? I'm sure you have I guess for our audience here, it's kind of sort of 20s, 30s beyond. Yeah.
No, I think traditionally it was a lot around the perinatal period, but that has really shifted. So I see women in, I guess in their 20s, maybe having problems with intercourse, pain with intercourse, lack of pleasure, struggling with orgasm, just anything related to our vulval area. Thinking about skin, when Alexis was talking, our vulval skin is no different to the rest of our body. So I treat women who maybe have vulval eczema. Now, I wouldn't be the only person involved in that treatment. We would work with a vulval dermatologist. But a lot of women turn up at my door being like, sex is really not great, or I'm not enjoying it, or it's painful. And actually the skin is very related to that. And you can have eczema, you can have psoriasis of your vulva, and no one knows about that because we just view that area of our body as so disconnected, I think, to the rest of us. And yet it's just all one. So endometriosis, adenomyosis, again, we're having a lot more conversations around that. No, I'm not going to heal those conditions, but I can help you with how your body responds or the pain that you experience. And then, yes, I mean, any point, we can have an incontinence as children, you know, as teenagers, as at any point. So I think what we're doing with pelvic health now is really opening up that conversation to be like, this is way out of the perinatal period. And menopause is a huge thing. Again, as menopause and perimenopause awareness is increasing, we're seeing more and more women coming through being like, oh, so I can go on a trampoline and not leak? Is that a thing? And I'm like, yes, it's a thing. And, you know, our bowel control or struggling to open our bowels. So it's vast. And I think a lot of the stuff that probably we put up with and think there's nothing I can do because we're not talking about it, when actually there is so much that we can do.
Well, that's good to know. What would your, if you sort of had three things that somebody could do if they were suffering, I guess I'm talking about, urinary incontinence here. What would those three things be, do you think?
Yeah, I often think about sort of three pillars, I guess, or three essential things, a bit like lifestyle. I mean, I really just building on what you guys have said, but our bowels are vital. And I know I'm like totally bringing the tone down of this conversation. Like, this ain't glam stuff, but essentially we all have bowels and we all know that we need to think about them. And it comes with our gut health and how that relates as well. But essentially, if we are constipated, and women are much more likely to struggle with constipation or IBS constipation than men are. And if we are struggling with constipation and straining to go to the toilet, then that's going to have a huge impact on other symptoms, whether it's bladder or otherwise, but also really not great for our pelvic floor muscles to be pushing and straining down on them. It's not strengthening them, it's actually weakening them. And it's always about layers. You know, that can then lead to change in our tissues, which then as we age becomes more relevant because of all the collagen changes that we've already heard about. That's relevant to our vagina as well. So sort your bowels out. Think about your bowels. Take care of them. Take care of your gut health is vital. Moving, being active, really wonderful for our pelvic health as well. And doing pelvic floor exercises, which again, we could talk about them, I'm sure, for a while, but look it up, think about how you do them. If you've never done them before, give it a go. They're relevant to all of us. And in the same way, if you stopped going to the gym and stopped doing any exercise, your muscles would weaken, or atrophy as we call it. Your pelvic floor is no different. So yes, they need a bit of TLC, especially as we move through life. So you don't have to do it once you've got symptoms. Do it now to prevent the symptoms.
And there's a connection, I presume, between, Sohère, your world as well, because obviously menopause affects, doesn't it, your continence in that sense, your pelvic floor. Is that right?
Definitely. And this sort of combined approach
Yeah.
is fantastic. Obviously, if there's dryness and urinary incontinence, then things like vaginal estrogens can really be of benefit as well. But it probably is very useful to see someone like yourself as well for some pelvic floor exercises and bladder retraining and things like that.
I mean, we know from research that pelvic floor exercises actually bring blood flow and actually help with the tissues, but I'm very much of a collaborative approach. You know, the reason estrogen declining is so relevant to our pelvic health is because your vagina and your vulva have loads of estrogen receptors, more than elsewhere in the body. I mean, for obvious reasons. Therefore, decline in estrogen has a massive knock-on effect to that part of our body. So that's why supplementation doesn't mean you need to necessarily be on systemic HRT. You can benefit just from estrogen in the vagina, and that can have a huge impact on your bladder and bowel symptoms. But we also know that we have the process of sarcopenia, which is where all of our skeletal muscles weaken. The pelvic floor is a skeletal muscle. So that's why the collaborative approach of we need the hormones, but we also need to do the exercises, it can all come together and make like literally life-changing experience to your sexual wellness, to being exercise. You know, we haven't touched on bone health, but you need to be active for our bones. So it's so multi-layered. And as women, I really believe this is so important because we're an aging population, and I'm so excited about that. I want to live until I'm 90, but I also want to be able to get off the toilet when I'm 90 and not be running to the toilet when I'm 90. So we need to do the work now so we can think about that.
Brilliant. Thank you. And just linking Alexis and Sohère, Alexis, do you see, how people taking HRT will affect the skin and you know, the menopause? How does it kind of play into each other?
Yeah, absolutely. And actually, just as you both are talking, I'm thinking the same. I mean, it's just so incredible how everything is linked in an amazing way. And that's why I think actually it's so important to talk about wellness and not just individual categories of our health. But I see obviously lots of women going through sort of perimenopause, menopause, and postmenopause, and all of these issues come up. We have a lot of conversations around HRT. A lot of those women are interested in HRT, but also feel fearful because I think of past sort of press. And so I think it's really important to kind of dispel some of that because it's really based on really outdated research. So absolutely, I think that sort of they're manifesting a lot of the changes that we're seeing, you know, whether it's the loss of collagen, whether it's mood changes. And again, I think those all tie in so much with skin health, and then just tie in with all the specialties and sort of interventions that you guys are talking about.
Yeah, I think maybe, you know, as everyone's talking and I'm listening, you know, I think the big take home is everything's connected and we need to start looking at the body as a whole, not just a series of little things. So, you know, like you said, your skin will affect your mood and then, you know, your bone density is going to affect your pelvic floor. So really we all need to start looking at ourselves as like full individuals, I think, and see how everything ties in.
And I think for people to know about specialists like yourselves, because I think, you know, sometimes you're kind of floating around just not knowing who to go to. So, you know, obviously knowing about you all is really helpful, which obviously everyone will after this. So I just want to say thank you all so much. I could have talked to you for hours, but I'm being very good. So thank you.
Thank you,
Thank
everyone.
you.
Everyone.
I feel like we need to go to the disco now.
I know, exactly.